G'day, I'm Jedynak, international educator and podiatrist, helping health practitioners master new treatment skills so you can get better clinical outcomes. Yesterday I received 3 great questions from podiatrist Wicks of Townsville in Queensland, Australia. I answered the first question on HAV angles in the previous video. If you missed it, I hope you'll go back now and check it out. You'll get a better idea as to what we're talking about in this video. Today, in this quick 3-minute video, I'm going to answer Aaron's question, the second question, which he posted in the FMT Society of Soul Savers in Facebook. His second question was, with the tool-assisted massage, what tissues are we targeting for HAV correction? Aaron, the answer to this question is pretty straightforward, but before I launch into it, I want to do a quick show and tell. Just in case you missed the boat on the tool-assisted massage workshop I delivered last year, this is what we're referring to. These are stainless steel tools that are used to detect and correct fascial restrictions that form when periarticular structures like capsules, ligaments, muscles compensate for abnormal joint function. This usually happens over periods of time of months or even years. These tools can get into the small, tough connective tissues and release the knots. This dramatically improves the joint function without wearing out the practitioner's thumbs, fingers and hands. This is such a cool tool, and as the participants in last year's workshop found out, I absolutely would not work without this tool. So those of you who already know about this tool, you'll know that it's highly effective to incorporate it into your HAV treatment protocols. Now, to answer Aaron's question, when it comes to treating HAV cases, you need to target and release all of the connective tissues that have contracted. Now, which tissues are they specifically, I hear you asking? This can vary from person to person, so you need to assess for soft tissue restrictions individually. To help you out, I'll highlight the typical tissues that need to be targeted in probably 80% of the HAV cases that we see. First, you've got to check the deltoid ligaments of the talus. This is because the typical displacement of the talus in an anterior direction will stress these tissues. Next, head down to the first MP joint and the lateral ligaments and capsules of the joint when you get displacement of the hallux. It's in here that these tissues tend to contract and tighten up, holding the hallux in that abducted position. So you need to release these tissues. Next, check the intermetatarsal tissues of the first and second met heads. Continual tension from the adduction of the first metatarsal often creates tender points in here, so you need to get stuck into them. Now remember the sesamoid apparatus? We covered this thoroughly in the workshop. The tough collagenous tissues, particularly on the lateral aspect, they need to be released because the first MP joint function won't be restored if you don't release those. The other area you need to check carefully is the base of the first metatarsal, particularly if there's a high IM angle. The tissues at the base of the metatarsal here will adapt to their shortest functional length. And if you're going to have any chance of reducing the IM angle conservatively, you've got to release these. So, in summary, Aaron, the tissues you need to check and most likely need to release using tool-assisted massage techniques are 1. The deltoid ligaments of the ankle. 2. The lateral MP joint tissues. 3. The intermetatarsal tissues between the first and second metatarsals. 4. The lateral sesamoid apparatus attachment tissues. And 5, the base of the first metatarsal. I hope that served your thinking and decision making, Aaron. The next clip will answer what diagnostic imaging is recommended for... Can you believe it? I hope that served your thinking and decision making, Aaron. The next clip will answer what diagnostic imaging is recommended for chronic ankle conditions. You won't want to miss it. Until then, serve with spirit, consult with care, and help more halluxes today. Or should that be halluci?